Originally from Nigeria, this is a population. Nigeria has a population of about 150 million people. It's the largest black population in the world. It's a small West African country. I immigrated here in 2000 after I completed my medical school in Nigeria. I went to a school at the University of Nigeria. It's one of the foremost universities in Nigeria. And on immigrating here, I did a residency in Huron Hospital in Cleveland, Ohio. Belongs to the Cleveland Clinic Health Systems. I completed that in 2004 and then went on to do a fellowship in infectious diseases in Tulane University in New Orleans, Louisiana. I completed that in 2006. I have been living in North Carolina since 2006. I am married to Choma and Sofo. We have two little kids. The first is a boy. He's aged 4. He turned 4, and I have a little girl who's 16 months also. And you know, when I get home, I open the garage door and I hear the shouts, "Daddy, Daddy, Daddy." That's you know, that's pretty good for you to walk home and have those little ones running around. Where I originally come from, the predominant diseases people had was predominantly infectious diseases, including malaria, pneumonias, tuberculosis, HIV. So while I was going through medical school, that formed the basis of my further education. Now also, I realized that infectious diseases physicians work like detectives, or people who solve puzzles. You keep picking up the clues until you crack or you can solve the case. And also, it deals with all specialties. It's not like you're limited to one organ or one area, but you deal with the individual in whole. I've come to meet the people, and the people are nice, they're warm, they always crack jokes with you, I crack jokes with them. So the warmth is the openness, the acceptance I got when I came here. That's what has kept me here. Also, the pathology related to what I do, my infectious diseases. Some of the things I had been reading, I came to see when I came here. Also, I've been working closely with the infection control team, trying to keep our rates of infections such as MRSA down. So this is the key things that have kept me going since I've been down here. Another reason why I moved down here was when I was still surveying the area, I realized that there was a great need for infectious disease practice. I had come about to see patients with complications related to diabetes, including diabetic foot infections, osteomyelitis, cellulitis. Also, I guess because of the I-95 corridor, I have come to see some HIV as well as sexually transmitted diseases and tuberculosis. The reasons why I bring up tuberculosis is that in recent times there's been a rise worldwide in tuberculosis, and people are actually concerned about the multi-drug resistant strains. I see patients in the hospital and as outpatients. Also, I work with the hospital infection control team in trying to monitor infectious diseases, trying to control it, as well as working closely with the pharmacist in the area of antibiotics, judicious use of antibiotics for targeted therapy. Yeah, what I like best about my job is dealing with the people. I walk into the room, and you walk into the room for someone who's sick, and you look at the anxiety, they want answers, and as you walk along with them, you crack the case, they get better. You walk back, you see that smile. That's makes you, gives you some contentment that you've been able to help someone. Some people will come over, will hug you, will shake you, and that gives you some fulfillment that you have done something worthwhile. As other physicians in the area get to know that we are around and we're offering such services, they call us and they send us patients. We pretty much have a good working relationship with both physicians we work with outside the hospital and physicians we work with in the hospital. I would like to just seize this opportunity to thank people of Robeson County in general. They've also been wonderful to us. We've enjoyed working with them, and we'll keep working with them, and we will be there to help anytime we're called on.